As ICU beds fill up in Paris and its surrounding region, Île-de-France, this week the government plans to transfer at least 100 patients to other cities to ease pressure on hospitals in the capital. Nationwide, the number of people in intensive care units has reached more than 4,000, while emergency resuscitation units are running at nearly 82% of capacity. That's the highest number since late November, when France was in its second lockdown. So far, the government is resisting calls from some medical experts to put the Paris region under another lockdown. Prime Minister Jean CASTEX appearing on the social media platform Twitch.
I believe that we must not resort to a lockdown, which is not out of the question. I say clearly, it is not out of the question. But we must use all the weapons at our disposal to avoid another lockdown, given the consequences it has for the population.
Under political pressure, the government has been relying on a 6 p.m. to 6 a.m. curfew to slow the spread of the virus. But some health experts say it's just not enough. Among them, the dean of the Faculty of Medicine of the Public Hospitals of Paris.
I hear it said often that each week without a lockdown is a week we have won, but I don't have the same opinion. For me, it's a week we have lost, especially when we consider the number of deaths. We have to remember that 1 in 4 patients in intensive care will die.
BRUNO RIOU says the English variant of the virus is spreading fast in the Paris region, especially among young people between the ages of 20 and 60, many of whom end up in the hospital. In the meantime, nationwide, some 5 million people have received a first dose of the vaccine, representing about 8% of the population. The rollout has picked up speed, but is still moving at a snail's pace compared to many other countries.